everyone, and welcome to the Good Doctor's Diagnose for Monday, April 13th. I'm Dr. Kristen. You'll notice a couple things are a little bit different than my normal GDDs. First of all, I'm in my house, which is rare. Even these days in work from home and social distancing. As you guys know, our factory is still open. So most days I'm working from the factory in extreme social distancing mode, armed with hand sanitizer and, disinfectant wipes, gloves, and masks. But today, I needed to work from home for a whole host of reasons, including that my body was quite done with processing the stress of this, and I was in a lot of pain. So I talked to my family / co-owners, and we decided that I would work from home today so I could have access to heating pads. Also, you'll notice that my hair is wet, which makes I don't love looking kind of, just out of the fresh and so clean out of the shower for you guys, but my hair dryer busted this morning. And normally I would stop at CVS and pick up a new one and, we would make it work. But of course, that's not a super big priority right now. So in a way of solidarity with everyone whose grooming routines are quite different, my hair is going to be so long at the end of this that I will probably be able to sit on it. Wanted to kind of have a minute of solidarity in that way, in that we are in a lot of elements of this all in it together. Of course, there are lots of us who aren't all in it together. This disease disproportionately is affecting people in poverty, people in different socioeconomic statuses, even potentially above or different than poverty. It's disproportionately affecting Black populations in America and other populations around the world. The number of cases in developing nations is reproducing much more rapidly then I have a feeling the numbers tell us, because the tests aren't getting there, let's be honest. So even though we are all in this together, in the idea that the whole planet is affected, I would encourage you today to take a minute to remember that it's a disproportionate effect. That no matter how hard all of our lives are right now, and they are, everyone's life is affected. There are moments of breath to be grateful for. There's some good news every day, probably even in your own life. It's an important balance to think about how do we both acknowledge how terrible it is and also hold the fact that a lot of us are still really privileged. Because while this disease does not respect privilege, it certainly is disproportionately affecting places with something else called what epidemiologists call co-morbidity. So things that also mean that disease happens faster. Poverty, especially in the United States, but around the world, is a major comorbidity. If you are somebody who cannot afford food on a regular basis, then your immune system is already shot. If you're somebody who can't afford clean drinking water, your immune system is already shot. If you're somebody who is on a whole lot of medications, an autoimmune disease brought on by years of abuse, or brought on by faulty or hereditary, and you could never afford your medications, this disease is going to affect you disproportionately. Pre-existing physical conditions have been talked about a lot as comorbidities, but they obviously are. If you're somebody with asthma, if you're somebody with a lung disease, if you're somebody with heart disease or hypertension, these are also things that it's disproportionately affecting. And that's really hard to say, I think, in some ways. It's hard to acknowledge that being a remotely healthy person who can afford fresh vegetables gives you a higher chance of survival of this. Now, I said the word chance. This thing is taking down people in all walks of life from all over the world. And we've talked a lot about how the world will never be the same. There you go. There's your obligatory Hamilton reference for this week of Good Doctor's Diagnose. But it won't. Because of that, because there's a lot of comorbidity factors, and there are lots and lots of things that affect different people differently. My little leadership tip for the day, my business leadership tip for the day, is to think about who is part of the conversations of your hygiene and strategy plans. So for example, when the city of Philadelphia announced its very first round of business closings, one of the things that was really overwhelming immediately for our company is that there was no definition of essential businesses that included manufacturing. There was also no conversation about public transit and no conversation about any sort of disability services throughout the city. So what that said to me, obviously, I knocked my little stand. So what that said to me was that people who were in manufacturing, who understood supply chain management and that essential business in manufacturing may not immediately look really important, but somebody who manufactures plastic bottles, you may think isn't essential right now, but those plastic bottles are the plastic bottles that go into EpiPens. Like that would still be really essential. That there was nobody in manufacturing at the decision-making table, that there was possibly nobody in public transit, that there was possibly nobody in ability services. There were missing voices at the table. And my question for you is, as your plans continue to evolve, because they're going to have to, I think we're on plan, I don't know, probably like X at this point of how we're adjusting as a company and making sure everybody stays safe, making sure that as all of the elements of your company that are going to be affected, that part of the decision is at the table, whether they're represented by a checklist you create to make sure that you're not forgetting anything, or physical voices of people in the Zoom conversations or teleconferencing. Decisions are stronger the more data you have. It makes it harder to make the decision sometimes in the moment because that much data can feel overwhelming. But every piece of social science research and logic I have says that the more information you have and the more things you've thought through before you make the final decision, the stronger the final decision will be. This is a hard time to do that much thinking. I'm not going to say it's not. There are days you're not going to be able to, and there are days that you then have to go back and change the decision the next day. And that's life. And that's part of the grace we're talking about and the flexibility that we're encouraging you to give yourself. But if you're in a place right now where you want to try to start learning some lessons and shifting some things and making sure you're better prepared for the next round of this, whatever it is, if it's another round of this disease before we get a vaccine, or if it's another global panic that we have to face in 5, 10, 15 years, one of the questions that we would encourage you to ask is who's at the table when you make the decision. In the meantime, we'll see you on Wednesday. We'll still be here making content, whether it's from our houses or from my office. We'll be socially distancing, washing our hands, and doing everything we possibly can to flatten the curve and stay safe. We hope you are too. As you are taking care of the people you love and are responsible for, and you've got any questions for us, please don't ever hesitate to ask. Stay safe, guys, and we'll see you on Wednesday. Bye.